Well, the Department of Veterans Affairs continues to play a pivotal role in aiding the Trump administration's response to the coronavirus pandemic. I want to welcome VA Secretary Robert Wilkie to further discuss this matter. Thanks for speaking with us today, Secretary.
Thank you for having me, Jennifer.
So first, a team of researchers at Henry Ford Health System in Michigan released a new study recently showing COVID patients given hydroxychloroquine were much less likely to die. Is the VA still using this drug to treat veterans who have coronavirus? And how do you feel the department's done so far in handling the health crisis among our veterans as well as staff?
Well, certainly with the hydroxy, we follow the guidelines of CDC and FDA, and that study in Michigan was illustrative. And I would also say that veterans are used to this drug. We use about 7,000 doses of it a day, and it treats everything from lupus to rheumatoid arthritis. But what the president has allowed us to do is we got an early start on this. I set up the first emergency operations center in January, and we sent out tens of millions of communications to the 9.5 million veterans and families who are part of our network. And mercifully, thankfully, we have not been hit as hard as was predicted. Right now, we're following about 3,400 cases. We've had 16,000 of the 22,000 veterans who have had this virus fully recover, and we have about 600 in our hospitals. So we were prepared, we acted, and we were so prepared we've been able to help the rest of the country by opening our doors to non-veterans.
All right, and the most current data from the VA, it shows about 20 veterans, guardsmen, reservists die each day by suicide. This has been a major issue you've been taking on there at the VA. That's roughly 1.5 times higher than people that don't serve in the military. And then from that figure, about 70% of those individuals were not under the care of the VA. So do you think the VA could improve community outreach to our veterans and to others to prevent suicide, especially during these times of lockdowns where people feel more isolated and they feel more depressed?
Well, the good thing is that President Trump is the first president since the 1890s who recognized the scourge of veteran suicide. The military has been keeping track of these numbers for 130 years. So just last week, we announced the first national roadmap to prevent veteran suicide, which is a whole of government approach. We use our research affiliations at VA. We're getting resources out to charities, to churches, to help us find those veterans that are not part of our VA network. And we're even using the world's most powerful computer, the supercomputer that Energy has at Oak Ridge, Tennessee, to formulate a more aggressive policy in finding these veterans. And I would add one more thing. You mentioned that 70% of those who take their lives by suicide are not part of our VA. The tragedy is that the majority of that 70% are from my father's generation, Vietnam. And this is one of the ways we are trying to close the last circle from that tragic conflict by finally reaching out 51 years after the Tet Offensive and almost 45 years since the fall of Saigon to help those Vietnam veterans who came back to a country that was not very receptive for them.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.